What is your name?
My name is Tom Bobel.
What is your job?
I'm an anesthesiologist, which is a physician specializing in anesthesia at St. Joseph in Lewiston, Idaho.
How do you use STEM in your job?
Everything we do has a calculation based on either patient weight, sometimes their age or physiology. We do a lot of math in calculating concentrations of drugs. We also use a lot of anesthetic gases, so we use partial pressure and gas concentration.
What class did you take in high school to prepare for college and your career?
I took as many hard science classes as I could. Chemistry, physics, calculus. Try to do physics with the calculus. I think that's important. Some biochemistry, electronics. But yeah, I stuck with the hard sciences to prepare me for what I did.
What recommendations do you have for high school students interested in being an anesthesiologist?
I would definitely say you have to push the limits, especially on the hard science courses. Take the honors courses, take the ones that if it's done with calculus, that way, but pursue, math as far as you can, physics and chemistry, and biology. I would stick with the mainstream biology classes.
As a college graduate, do you have any important financial decision-making tips you could give out?
As a college graduate, as you know, financially finishing college, right there, you're ahead of the game for jobs. I would advise in today's market and the way the world is today with college that students look for, I hate to say it, but a college degree that's going to work towards a job. It has to be part of the plan. My generation was one that did a lot of liberal arts, a lot of English, a lot of history, this and that. And it really doesn't prepare you for anything but teaching that. And I think if you have a career goal in mind, you need to have college as part of that career goal.
Thank you.
You bet. Anesthesia, if you're going to have somebody go to sleep, is primarily two modes. You either give them intravenous medications, which is going to be based on weight, but a lot of the anesthesia we're going to do in the operating room is once the patient's asleep with IV medications, giving them anesthetic gases. This is an anesthesia machine that blends 3 different gases here, so you're available to vary that based on primarily what the patient's lungs are like, if they're good or not. You've got oxygen, you've got an air mixture, and you've got nitrous oxide. Nitrous oxide is laughing gas. It's a weak anesthetic, and what you typically have to do is then add into that mixture what we call one of the halogenated ether anesthetics. So that's what we're going to blend in here. These are all based on percentages, so there really is no weight criteria that we would do on this. It's based more on a percentage of concentration. Normal oxygen in the air is 20%, so you want to be at least at 20%, if not more, for safety to the patient. It's administered through a closed circuit here, and then you have over here you have a soda lime scrubber to take out the carbon dioxide. And then, even though it's not turned on right now, we have a series of monitors up here, not only for the patient's blood pressure and heart rate, we're also monitoring the gases that they breathe in and they breathe out, the percentage of oxygen, and the various anesthetic gases. So this machine is highly technical and costs about $60,000 to $80,000, and has a lot of really amazing engineering and fail-safes in it, because once you hook a patient up to this, you've got to breathe for them. There's no other way that they can survive without it. So this is the ventilator here that you're going to use. We also have a way that we can hand ventilate as a backup. There's a separate power supply in here in case the power goes out. And that's, in I guess 2 or 3 minutes, what we do with an anesthesia machine.
Thank you.
You bet.